Non-visualized antral follicles at 39. This was a 39-year-old para-2 whose last menstrual period was more than 1 year prior to presentation. Now, this is the transvaginal video of the apparently normal size uterus. Note that the bright line of the endometrium is not clearly seen here. So let's play the video. So now panning, bowel, some fibroid seedlings. Consider on panning, the ovary was not visualized. Now rocking, the cervix to the fundus, not the thin endometrium here. So I'm trying to trace the ovary. You can see the ovarian ligament here. And we expect the ovary to be somewhere here, but one cannot see any follicle here. The iliac vessel here, and the ovary usually overlies the iliac vessel. So you can see somewhere here, but not very sure. What makes the ovaries detectable are the follicles. So here apparently there is, or there are no antral follicles. And of course I couldn't see the ovary on the other side. But the uterine measurements normal. Note that the white line of the endometrium is not clearly seen here. So with this history, ultrasound findings are requested for follicle stimulating hormone because of course I suspected premature ovarian insufficiency. Here you have the follicle stimulating hormone greater than 100. Well, I want to be sure before you label a lady at 39 years para-2 in an environment where the fertility rate is high, one needs to be sure. So I requested for a repeat of the follicle stimulating hormone in a different laboratory before I discuss the findings with the patient. So 124. So it's certain that what we are dealing with here is a case of premature ovarian insufficiency. No antral follicles on 2D imaging, FSH greater than 100. So, but when Nessie came, someone requested for anti-Mullerian hormone. Of course, this is to be expected. It's low. But if I were the one, I would have requested for this because this is a very expensive test. Very few centers do this where I practice, and this will not add value to this patient because generally anti-Mullerian hormone levels decline earlier than follicle stimulating hormone and estradiol. So what it means is that when the follicle stimulating hormone is this high, it tells me that this is already low. So for this patient, this is additional cost with detailed value. On the other hand, if the follicle stimulating hormone was normal, yes, I would have requested for the anti-Mullerian hormone because it will help detect diminished ovarian reserve when other markers are within normal limits. All the same, we counsel these patients. At times, it could be difficult to trace the ovaries. One may need to use a GPS. The uterus lies on either side of the uterine body. If we appreciate this, it will be easier for us to trace the ovaries. It also overlies the iliac vessels, especially if traced on transverse section. And at times in postmenopausal women, echogenic area around the ovary will make it easier for one to identify the ovaries. One can push the bowel with the left hand while manipulating the transvaginal probe. One can also follow the ovarian ligament on transverse section or apply Doppler to trace the utero-ovarian vessel in transverse section. We shall see that in the next slide. So this patient presented with abnormal uterine bleeding. You can see collection within the endometrial cavity. So here in transverse section is the fundus of the uterus. So one can follow the ovarian ligament here And here you are, ovaries. One can also follow the uterovarian vessels from the region of the fundus, the lateral pelvic wall, as seen in this video. So, using the uterovarian vessels to trace the ovary. So thank you very much for listening.